Bismillahirrahmanirrahim. Assalamualaikum and welcome back to the second episode of ChemLife where we have chemistry in every story. This is the part 2 of Megadose Vitamin C podcast, the show that never dumb thinkers' boldness. Please watch the part 1 if you miss it, and if you don't, thank you for joining our podcast today.
Okay, as we all know, um, some some drugs can interact with the other drugs with other medications in our body. So, is there any medications that can interrupt with vitamin C, or can vitamin C interrupt with any medications?
Let me answer the question. So drug interaction with vitamin C is actually there are just a few severe interaction. Um, Other than that, there are mild to moderate interactions such as with the anti-cancer drugs. There is a concern that using antioxidants such as vitamin C during chemotherapy might reduce the effect of chemotherapy drugs. Other than anti-cancer, there are also some moderate interaction with warfarin blood thinner. Taking high dose of vitamin C might reduce the activity of anticoagulant in our body. So, if taking warfarin with vitamin C, the patient might need a higher dose of warfarin, and we need to also monitor the level of the blood parameters for the patient.
Oh, okay. Wait. So, if a person is taking warfarin, because my father's actually have is prescribed warfarin.
Warfarin.
Yes. So you mentioned the daily vitamin C intake for male adult is what, Christina?
90 milligram.
So my father should take below 90 milligram of vitamin C.
No, no. Actually, if um, it is actually he need to consult with the doctor first whether he need supplement of vitamin C or not.
Yeah.
In this context, we are talking about the vitamin C supplement or the high dose of vitamin C. As for the natural sources of vitamin C like fruits, vegetable, there are no interactions.
Yeah,
It is
true.
just fine. Yeah, it is fine to eat
Uh, and also
in
I
moderation.
want to add about the warfarin actually, because if a patient taking warfarin, the pharmacist and the doctor will advise the patient to maintain the amount of vegetable and fruits taken. If he took like leafy vegetables, only a cup, or orange maybe a half. So the diet of a warfarin patient should be very strict, because actually there's an interaction between the warfarin and also because in vegetables we have vitamin K. Vitamin K and also warfarin, it has interaction. So for warfarin patient, they need to consult pharmacists. The need of using exogenous or supplementation of vitamin C. And for the diet, the amount of vegetables and fruits should be strictly monitored by the pharmacist, and do not change the diet abruptly. You need to consult your pharmacist or doctors.
Yeah.
Yes, that's important.
Yeah, the doctor also said the same thing.
Mm-mm.
So when taking leafy vegetables, if one day is half a serving of vegetable, then the next day and the next day also have to
To
be
be
the
the
same.
same. Yeah.
Yeah.
Yes.
Okay.
So
Next part.
uh, as this far, I think Megadose Vitamin C giving and showing us its bad attitude and disadvantages. So, in what condition or cases someone need to take uh, Megadose Vitamin
Kados.
C? Because there is no reason why there's a lot of product vitamin C being advertisement.
Yeah. Okay. So for this question, in for whom that need up to like 2,000 milligram vitamin C daily. So if a patient that have burns, it actually advised for the patient to take vitamin C that is 1 to 2 gram, because vitamin C, as mentioned before, is an antioxidant. So it play roles in the healing of the wound. So that's when the needs for the high dose vitamin C for burn, uh, maybe for someone that having accidents, injury, and also if a person's taking antihistamine, because antihistamine is for sinus, rhinorrhea, runny nose. So if the antihistamine is uh, not effective, means not show any progress to this patient, in community pharmacy we advise or suggest to take only 1 gram daily as supplementation, in order to reduce the period of symptom. Uh, so that's the patient that need the high dose. First, burns, accidents, or having allergic rhinitis or a stone.
The burns. Can it also treat like third degree burns? You know, the burns that the the burns that is worst, that is very bad. I mean,
So
like, huh?
for
How would it treat?
the degree, the like third degree of burns, actually, the patient will be admitted to the ICU. So at that time, so maybe the doctor will intervene, maybe either to take to give like just IV vitamin C, but uh, I'm not very sure about the chronic burns. However, for the mild burns, maybe it can vitamin C supplement through oral may benefit the patients, because it will improve the recovery of the tissue injury.
Okay, so that's oral medications. What about topical application of vitamin C? Would
Okay.
it be the same?
For topical vitamin C, it's actually if you watch any skin into this, they say that topical vitamin C is good for skin brightening, because this topical vitamin C is have been proven it can like fix your scar, acne scars, hyperpigmentations, acne scar, hyperpigmentations. So the rules is more to like the brightening effect, if it is locally applied to our skin.
Okay, I see. Thank you, Sister Afika. Pa, back to you. Eh, no, back to me. Okay. um, Sister Christina, you mentioned
Yes.
that vitamin C have to be taken orally. So why can't our body synthesize vitamin C? Because some animals can synthesize vitamin C, so why can't us humans, since we are a compressed creature?
That's an interesting question. Yeah, that's true. Most animals are able to synthesize ascorbic acid from glucose in their kidney or in the liver, but we humans, according to a scientist named Linus Pauling, he won the Nobel Prize in chemistry, and he said that human lack of this one enzyme called L-glucosamine lactone oxidase. So this enzyme is important because it catalyzes the last step of vitamin C biosynthesis in our body, which is the conversion of L-glucosamine lactone into the ascorbic acid. So if we don't have this enzyme, so we cannot convert the lactone into ascorbic acid. So that's why human cannot synthesize vitamin C.
Okay. So the lack of enzyme.
Yes.
Okay, thank you.
Alright, this question might be slightly different from the previous question because we talk about synthesis vitamin C. So before this, Sister Kisna mentioned that smoker need vitamin C. But I would
Yeah.
like to ask Sister Afika, why smoker need more vitamin C? It is a way to help them to quit smoking or other reason.
Okay, this is because the smoke from the cigarettes, as you guys know, is very toxin. So it's actually the 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 smokers will have increased oxidative stress from the toxins from the cigarette smoke, and generally the smokers they have lower blood concentration of vitamin C. This the recommended daily allowance RDA for smokers, as mentioned before by Sister Kisina, is 35 milligram more than the normal adult, which is around 125 milligram daily for smokers.
So how about the passive smoker? They also need more vitamin C or they just consume what they want to consume?
For the passive smoker, it's actually same as the active because they indirectly inhale this smoke from the cigarettes. So the likelihood of having increased oxidative stress from the toxins will be also high. So, but it is just 35 milligram higher compared to the normal adults. And if you wonders, okay, we need around 90 milligram, and for the smokers 125 milligram daily of vitamin C. But why in the pharmacies they sold like 1000 milligram vitamin C for the adult, for the children's maybe 300 milligrams vitamin C. uh, so because I mentioned before, the absorption is actually complex. uh, so if you took like 500 milligram daily, it is still tolerable for adult.
So wait, so you mentioned 5,000 milligram.
500
Oh, 500.
500
Oh,
milligram.
okay.
Terkejut.
Okay, okay.
Confused 1,100.
Okay, so does this means that smokers smokers is more exposed to the risk of having scurvy? Scurvy is is vitamin C deficiency, right?
Yes. But in Malaysia, we the case of scurvy is very rare. The
Yes.
scurvy, um, the case is higher in undeveloped country like maybe like India, Nigeria, because they have also other comorbidities, which is like the poverty, and they is apa underweight. So the intake of vitamin C and other nutrients also low. So so that's when the scurvy come into action for body. But in Malaysia, it is very rare because we know that Malaysia people eat a lot, right? Also
Yes,
diabetes.
yes,
So so the scurvy case is very rare.
yes. We are blessed with food.
Yeah.
Yeah, alhamdulillah for that. Okay, so that's about smoking. So let's relate vitamin C to today's current situation, COVID-19. So there's lots of talk around where there is a relationship between vitamin C and human immunity, immune system. So what is your opinion on actually using high dosage of vitamin C to fight COVID-19 infection? Is it usable, the theory?
In my opinion, if the purpose of taking high dose of vitamin C is to prevent the COVID-19, actually there is no necessity to take it because there is very little evidence saying that it could prevent COVID-19. Yeah, it is actually vitamin C could enhance our immune system and all, but we need to take it in moderation. And if you
Yes.
want to take the standard dose of vitamin C as a supplement for the general well-being as a health supplement, there is no harm to do that. Everything that is taken in moderation is fine. But to say
Yes.
that taking high dose vitamin C could protect us from COVID-19, I would say I am not agreed with that. And if we take a generous amount of fruits and vegetables, it is actually enough to supply vitamin C in our body in this situation.
Okay, so the perception that taking vitamin C could actually prevent us being exposed to COVID-19 is actually a myth. It's not true.
Yes, yes.
The research is actually not well established, so we cannot give like
A
suggestion
concrete
it can like
evidence. Yeah.
prevent. Yeah, but as a prophylaxis, because as mentioned before, vitamin C is actually an antioxidant, and it plays roles in the respiratory mechanism. As a prophylaxis means if you're a person that easy to get like flu or rhinorrhea, runny nose, you can take vitamin C supplement, but in a dose of like not more than 1,000 milligram. Up to 1,000 milligram is still tolerable. So that's my verdict for the uh, question just now.
Okay, one last question.
Okay.
Um, since you guys are from the pharmacy field, right? So
Yes.
my question is, since you guys are from pharmacy's field, so there is no cure for COVID-19 as we all know currently.
Yes.
So what are your suggestions as future pharmacists, as pharmacists, to enhance the body's protection, the body's response to for immunity response? Do you guys have any suggestions, like how to take care of our health?
Maybe Christina want to answer the question first. Then I top up.
Mm. So the basic is to take a balanced diet.
Yeah.
Consists of enough fruits, enough vegetables, enough proteins and carbs. And also we need to uh, yeah, although we are in a lockdown situation, we also need to exercise regularly, and it also help in enhance our body system. And drinking a lot of water also helps in some ways improve our general well-being. Yeah, so if we eat a healthy and balanced diet, actually we do not need any extra supplements to
Yes.
supply vitamins our body.
True. So the need of to take supplement vitamin C, it will come if you a person that not fond of vegetables or fruits, or it is hard for you to get the natural source, the vegetables and fruits. So you can opt to consume vitamin C supplement. So that's the need come. And also, if you're having like as mentioned before, the disease like maybe you have restung, allergic rhinitis, or burn, or accident, this vitamin C, because we know it's a very powerful antioxidant, and it proved to help in tissue recovery and also play roles in the respiratory mechanism. So you can take, but in a as a dictated by your pharmacist, the dose.
Okay. Thank you. Apa?
So I think to conclude this podcast, if you want to take vitamin C, take moderately,
Yeah.
and if you didn't need what else? Alright. So if you want to take vitamin C, you need to take moderately, and if you a patient who lack of vitamin C, you need to uh go and seek help from the doctors. So everybody, thank you so much for hanging with us on the Chem Life, where we have a chemistry in every story. You guys can follow us on whatever social media you guys are listening or watching from. We are on YouTube, we are on Instagram. Whatever it is, please be sure to follow us on social media for a lot of information, programs, and a lot of activities. And finally, the last absolute things that we are going to ask of these guests. If I could request you guys can make any sort of outro that you want, it could be motivational word, it could be message to someone, and you also can scream if you want, anything you want. Maybe Sister Christina first.
First of all, I would like to thank the organizers for inviting me to join you guys this evening. And thank you also for the audience or the listeners for listening from the beginning to the end. I
Yeah.
apologize for any mistakes if there is any along the session. And I would like to wish all of you guys good luck in the future, especially my seniors and Sister Afiqah also.
Thank you.
Congratulations for graduating Bachelor of Pharmacy. So good luck in your future.
Thank
Stay
you.
safe, stay healthy, everyone. And the most important, if we have any problems, don't keep it to ourselves. Find
Yeah.
someone reliable that can listen to us. And as a friend, we need to keep checking our friends as well and just ask, "Hi, how are you?" It helps a little because someone once said to me that in this difficult situation, any nano size problem would look as big as tera size problem. So let's
Yeah.
have each other's back.
True.
That's all.
All right, thank you, Sister Christina. Sister Africa, if you want to say something.
I would like to thank the committee for inviting me as the speakers, and also good luck and all the best to Christina, also Awani, and also Farha
Thank
in
you.
journey of this degree. It may like uh, sometime may hard for you, but trust me, you will come to the end of it, and then you will be ponder the journey of the degree. So enjoy. Don't stress yourself too much because life is short.
Yeah. Yeah.
Life is short. You have to make yourself happy first. Okay,
Yes.
and also like Christina said before, we need to check our friends. Can so be friendly through WhatsApp because we have social media, so we can
Yes.
connect each other. So use this media appropriately during this pandemic. And also if you can do like maybe just take a stroll around your compound, it helps me a lot because I'm an extrovert person. I do not like to be in a room every day.
Yes,
So
same. Me too.
if I have time like stroll around the compound, it just like make my day and also increase apa the mood of my day.
Yeah.
So that's all from me. So good luck everyone and stay safe.
Thank you. All right, thank you, Sister Africa and Sister Christina, for being our guest in today's podcast. Have a great one. For the viewer, if you have any question or maybe you have a suggestion for the next topic for us, please send it with the hashtag CamLife and let us know on our social. See you on the next episode. This is the podcast, the show that never done thinkers bonus. Goodbye and Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam.
Bye bye.
Bye.